that there is a middleman that stands between them and their the pharmacists and their customers too much. There's something called pharmacy benefit managers, and they're the middleman between the drug company and the pharmacist. And these pharmacy benefit managers, these middlemen, have in their contracts often a gag clause that stops Aaron and Mr. Saltzman in the back from fully disclosing. They're not allowed to talk to their patient, to their customer, about ways of saving money, whether they should, to say you could save out of pocket instead of going through your insurance plan, which happens many times. It can be 10 or 20 or 30 or $40 savings for the patient, but they're not allowed under this gag clause to do this. So a group of us got together working with the pharmacists around the state, around the country, wrote legislation, got it through both houses, the right to vote, drug price legislation, and the President of the United States signed it last week. And this will mean that pharmacists can do what they want to do. I mean, pharmacists have, a big part of these community pharmacies is they have personal relationships with their patients that come in from the neighborhood week after week, and they want to be able to disclose to them and talk to them about how to save money and how to get the right prescription drug. And this will enable them to do their job better. The reason they went to Ohio State or Ohio Northern or Neomed, and went to pharmacy school. And this is only a small part of the problem with high drug prices. Obviously, we need to do more. I have legislation that one newspaper said it's the legislation that drug company lobbyists hate the most because it goes after high drug prices. This is a start. It's eliminating this gag clause. We have to do a lot more. And that will be coming next session, I hope, and moving forward. So if you would talk about what this means to the nurse profession. Thank you for being here. Thanks for allowing us to be here.
No, thank you. Thank you so much. So on behalf of Equitas Health, all of our pharmacists and our patients, we really appreciate the work that you put in. Senator Brown has put in a ton of dedication, hard work, and leadership skills into getting these two very important pricing bills passed for us. These drug pricing laws allow pharmacists the ability to disclose prices to patients when an insurance company is charging a copay higher than the price at which they would pay at the pharmacy just out of pocket, which is a huge, huge benefit. So because pharmacy benefit managers in the past have had gag clauses on pharmacies, we couldn't tell a patient sometimes when a medication might be cheaper to pay out of pocket instead of using an insurance plan, instead of purchasing the medication through their insurance. So we really appreciate these laws getting passed and being able to get patients their medications at a lower cost. It's a huge win for our patients. And we see this on a daily basis. We're trying to save patients money on a daily basis now that we can disclose this information to patients. Really, thank you so much for being a true champion.
Sure. Thanks. Questions for either?
We'll do questions.
Over there. Patients are going to get out. Yeah.